Hello friends, let's enjoy Dr. Y's chest radiology. I'm Dr. Y, medical professor, chest radiologist, Seoul, Korea. Chapter 64, Lung Cancer as an Obstructive Pneumonitis on chest x-ray and CAT scan. Let's go! Today we're gonna focus on the radiographic findings, chest x-ray findings of obstructive pneumonitis due to lung cancer, and they will be confirmed by contrast-enhanced CT, coronal and axial settings, and also with PET-CT images. Let's focus on the frontal chest radiograph. Let's go. This is the first case. What do we see? Yes, increased opacity, relatively homogeneous increased opacity, right upper lung zone with elevated right minor fissure, and also with elevation of right hilum, and also with elevation of right hemidiaphragm, suggesting phrenic nerve invasion. Right? Then what do we see on the axial contrast-enhanced CT? Yes, right upper lobe mass obstructing right upper lobe bronchus and the resulting right upper lobe distal collapse, so making the famous sign inverted S sign. Proximal mass and distal collapse of right upper lobe due to lung cancer, usually from squamous cell carcinoma. The axial fused PET-CT image shows where the tumor is, showing hot uptake, orange-colored hot uptake of right upper lobe mass and 4R lymph node enlargement from the mass on medial side. Please compare the findings with axial enhanced CT, where the tumors are right upper lobe lung cancer and 4R lymph node enlargement. Also, we see number 5 lymph node, AP window lymph node enlargement on the axial CT scan. The second case, we also see the famous sign inverted S sign or Dr. Golden's S sign, showing right upper lobe collapse of lung cancer from right upper lobe bronchus obstruction. Please see the lateral film. We see the lower margin of right upper lobe collapse, showing minor fissure in front and major fissure in the back. The coronal and axial non-contrast CT shows where mass is. The arrow indicates the proximal mass obstructing right upper lobe bronchus and distal atelectasis, showing Golden's S sign. The last image, the PET-CT axial image, shows how big the tumor is. You gave me good and also with subscription. Thank you very much. Grazie. Let's move to third case, different lobe. What do we see? The upper arrow indicates downward movement of minor fissure, and lower arrow indicates intact normal CP angle area, which means right lower lobe is normal, not involved. But we see the clear margin of right heart border. That means right middle lobe medial segment is okay, free, not involved. We can confirm the right middle lobe lateral segment collapse from the lateral film on your right side. Let's confirm these findings from this axial CT and PET-CT image of the same level. The mass is there, right middle of proximal portion with a heart uptake, but the distal portion of a right lateral segment is just collapsed without heart uptake. And also we see the empty normal area of right middle of medial segment. That's why we saw the clear margin of a right heart border, because right middle of medial segment is not involved. This is small cell lung cancer. Where have all the flowers gone? Do you like this song? Sung by Marlene Dietrich or Joan Baez or Nana Muscri. What is flowers? Where have all the Marlboro men gone? These handsome, gentle, strong, dandy-looking men. Regrettably, most of them died from lung cancer or COPD. There is no more Marlboro Man now. Stop smoking, please. The fourth case. What do we see now? The right upper lobe lesion is old TB scar, tuberculosis scar. Please forget it. What do we see from the frontal radiograph? Increased hazy consolidative density, right middle and lower lung zone. The right heart border is clearly saved, not obliterated, not obscured. That means right middle of medial segment is okay. And also we do not see the right diaphragm margin, and right CP angle area is not normal. That means right lower lobe involvement, right lower lobe collapse due to lung cancer. Let's confirm it from the lateral film. We only see the one diaphragm with the stomach, gas-filled stomach on left side. Where is the right diaphragm? It's involved in right lower lobe collapse. We see the frontal side margined by right major fissure. And also we see the top portion of right lower lobe is okay, disease-free. That means superior segment is not involved in this lung cancer collapse. These two axial contrast enhanced CT and PET-CT scan of the same level shows where the tumor, where the heart uptake tumor is, that is right lower lobe proximal portion, and other consolidation or obstructive lesions is right lower lobe. The bronchoscopic findings are luminal protruding squamous cell carcinoma. This fifth case is interesting. Let's enjoy what's the difference with the previous fourth case. Let's first see the lateral film. Almost similar, same findings. Right lower lobe involvement, saving superior segment. But we see clearly the two diaphragms. What's the difference? On the frontal radiograph, we see the normal right heart border. That means right middle lobe is okay. And also we see the normal pulmonary vasculature and airway all through this mesh-like, consolidation-like density. What is this? And we see the right diaphragm margin and relatively clear right CP angle area. What's the difference? Let's imagine. Let's expand our imagination. These films show the answer. You got it? This case does not showing us collapse. Collapse overlapping right diaphragm. Not collapse, just mass, just large mass involving right lower lobe, saving the border of right diaphragm. normal right middle lobe. This is also the squamous cell carcinoma. We also see the supraclavicular lymph node enlargement, involvement on second image of PET-CT. Let's move to left side. What do we see? This is another famous image, another famous sign, the Luftsicher. What do we see? We see hazy increased opacity, left upper lung zone, and elevated increased size of left hilum. Also, left diaphragm is elevated, showing phrenic nerve invasion. The arrow indicates aortic arch surrounded by air of left lower lobe superior segment. That is Luftsicher, a secret sign of the famous left upper lobe collapse. Let's confirm these findings, all of these findings with left lateral filum. Yes, the arrow indicates forward movement of left major fissure and increased density in frontal area. That is left upper lobe collapse. Also, we do not see the normal round left upper lobe bronchus on the lateral filum. We only see the round opacity of right upper lobe bronchus. These axial images all show the left upper lobe mass about 3 centimeters obstructing left upper lobe bronchus and the distal lobar collapse. The last case, and also the interesting case, what do we see? This old man. Yes, at first glance, it's looking somewhat normal looking, but we can find something wrong about left heart area. We see no aorta, paraspinal stripe on left side, and left diaphragm is also not clear on the medial end, and we don't see the normal vascular structure and airway behind the left heart, left ventricle. And if we trace the large airway from trachea, carina, left main, and left lower bronchus, there is a blind pouch at left lower bronchus. This is left lower lobe collapse due to lung cancer. You can confirm it with lateral filum on your right side. Yes, left diaphragm posterior portion is elevated and obscured, and increased density on the posterior inferior area. We sometimes call it positive spine sign when there is more density on the spine. These two axial images are showing us left lower lobe distal bronchial tumor mass with obstruction and distal collapse. The heart uptake of PET-CT is showing us where the tumor exactly is. This is the squamous cell carcinoma obstructing left lower bronchus, showing us obstructive pneumonitis of left lower lobe. Madam, you quit smoking? Wonderful. This is the most wonderful job of you this year. Congratulations.